People management is a suite of resources which helps organisations to develop their human resources policies and practices. It's particularly useful for those organisations who smaller providers who may not have access to a large human resource department. It includes 14 audits so that people and organisations can assess how good their human resources policies are. And again, there's links to a database of support resources and so forth. The Good Practice Framework is a self-audit tool that we provide, and it's provided on the principle that practice should be based on knowledge and evidence. It's a web-based self-evaluative audit tool which provides a good practice journey. We recognise that good practice can be familiar as well as innovative, and we do encourage organisations to think about what they do on a day-and-daily basis and to recognise that as potentially good practice. We also appreciate that innovations are ideas that have to be tested in practice. So we encourage people to use the Good Practice Framework to I suppose, think about and audit an example of practice, to share that with other people on the website. And we also use the good practice for when we send out calls for evidence. When we're developing a guide around a topic, as well as going to the literature, we look for examples of good practice that are based with specific reference to a case study. So we send out calls for evidence, and we encourage people to come to our website and use the Good Practice Framework audit tool to upload their example. And we hope that this will promote the sharing of good practice and enables professionals to find out what other organisations are doing. We have our care skills base. Evidence does suggest, as I've alluded to, that many social care staff do lack ability or confidence sometimes to apply communication and number skills effectively in their jobs. And the care skills base was created by SCIE and Skills for Care. It's a practical web-based resource that helps social care employers improve the communications and number skills of their staff. We have 38 different audits, and it allows employers to manage issues of risk to safety and quality of the workforce. And the pro forma is developed in such a way that it goes beyond the audit to look at a development plan of how learning needs will be met. And it facilitates a kind of a constructive environment for staff feedback and allows staff to contribute to their own development. We have our Dementia Gateway, and it's a suite, and this is the landing page, it's a suite of resources particular to dementia. So we have end-of-life care, making decisions, things about getting to know people with dementia. So the whole social context of dementia care as well. Eating well is an example, and just scrolling on down. So that's just to give you a flavour of that gateway. I'm watching the time. We have our multimedia e-learning resources. Again, coming from a background in lecturing, I'm relatively good with IT. I have my limits to which I want to take it. But I am very much aware that we're now working with a population, or a sub-population of social care workers who are very IT literate, who are very much into social networking, and love doing things on the computer as a way of learning. I believe Google is now an official word, that you can Google something. So we do have multimedia e-learning resources. Again, they're much more an interactive way of learning. They can be accessed from any internet-enabled PC, and they're designed to engage either individuals in their own self-directed learning. People can print out learning records, and they include a range of simulations, quizzes, case studies, short commentaries, videos, lots of different things, all singing, all dancing, and it's another medium through which people can engage with learning and maybe make it a more enhanced experience. All our e-learning resources are supported and linked back to any of our practice guides or our research briefings so that people can refer to those for further reading. And that's just a screenshot of our e-learning webpage. So you can see we've the very top one with managing knowledge to improve social care, and it's a good resource that an individual or an organisation can think about. Are we a learning organisation? How well do we use knowledge to improve our services? Communication skills, residential childcare, children of prisoners, dementia, mental health of older people, multidisciplinary working. So we've a good range. And last but not least, we have Social Care TV, which is becoming increasingly popular. It is a broadband channel, so I do advise people that if they're really, really restless at 2:30 in the morning and they really want to watch a film about social work or social care, that they can get up out of bed and they can go and watch Social Care TV. It's available all the time. We have, it's Social Care, we're not allowed to call ourselves SCIE TV for obvious reasons. When I wasn't logging post, I received a knock at the door one day. There was 2 guys trying to sell me SCIE TV. They got really confused when I was trying to sell them my SCIE Social Care TV. So, but we do recognise that films can often bring a subject to life in a much more accessible and emotive way than a printed word. Films can be downloaded. I have managed to download them onto PowerPoint presentations. They can be used for self-directed study, CPD. They can be used in a vast array. I will say the films are relatively short. They are not 2-hour-long, award-winning Oscar performances that I know of yet. They range between 10 minutes and half an hour. And you can go into different segments of the films if you've only got 2 minutes and 37 seconds of time. We're updating them monthly, and at present we have about 60 short films. So they are, the feedback on the ground has been very positive. People really like the films, and I find them as a complementary way of learning. An example where I found the Social Care TV particularly useful was lecturing once about youth conferencing and youth justice. And I talked about the policy, the backdrop of youth conferencing, where it originated, how it happens, the process, who's involved, what takes place, and the outcomes. And I thought I was teaching it in an accessible way. I thought I was teaching it in a way that people could grasp the concept. And it wasn't until I put up a short film that showed an example or a role play of a youth conference taking place that some of the students said, "Oh, I get it now." And I think that visual way of learning for some people, providing a film enhanced that and consolidated their learning. And again, our suite of TV programmes complement our research and guidance. And we hope that those range of ways of providing information, and with our plain English policy, enables workers to access information, because information is only good if people can understand it and apply it. And there's just an example of some of our films. So we have Days in the Life, Disabled Children and Young People, Dementia, Innovation, Looked After Children, Mental Capacity, Safeguarding Adults and Children, Seldom Heard Groups, Working with Lesbian, Gay, Bisexual and Transgendered People. And an example of one of those films, it talks about Richard, an older man who is gay in a residential home. And I suppose it challenges people to think about beyond stereotypes of about older people in terms of their sexuality and their needs, and people in residential care. So that's very briefly an overview of what we do and what we provide. Do keep in touch. You can sign up for new developments, events and resources. There is, if you can see it, a URL link there, and if you want to provide comments or any feedback. We are increasingly looking at working on topics where there's a health and social care interface, and I know that previously SCIE has worked with NICE where the two convene. And if you look across the top blue tab, there's the home page. On the left hand side, our resources are categorised either by resource type or by topics, and subtopics are presented within the landing pages of that. But just to the right of the home tab, you will see email updates. So if you're interested in registering to find out what we're doing or what's coming out, you can do that there. Thank you.
Thank you, Shirley. I've just got this image of waking at 2 in the morning to watch a film about social work. Have you got one question before we eat for Shirley? No? Okay.
Very hungry.
They're very hungry. Thank you very much,
Thank
Shirley,
you.
indeed. Could I just, on your behalf, not only thank Shirley for that very interesting insight into the knowledge base and procedures to promote good practice in social care, which is very often overlooked in our conferences, so thank you very much indeed. Could I thank Paddy for putting it into perspective this morning in terms of the department, for Chris talking about implementation, awareness raising and feedback, and all of the issues around NICE, which we have to have every year, for Jim and the importance of the warehouse as well as the silos. I hope that encapsulates your talk. For Miriam on the ups and downs and twos and pros of evidence-based commissioning, for Damien on national audits, the importance of national registry, and finally Shirley on knowledge-based and social care. So many thanks indeed on behalf of GAIN to all 6 of our speakers today. Thank you very much.